Eye bags, crease and loss of volume at eye cheek junction in early 20s. Which treatment is best? I have volume loss around my cheek area, resulting in purple bags under my eyes. Hereditary. I was okay when it was just a tear trough deformity, but the bag has now gone around to meet the outer corner of my eye. I think this is the palpebromalar groove. My biggest concern is that every morning I now wake up with a permanent crease here, and it is getting worse. I'm willing to consider anything, blepharoplasty, fillers, fat grafting, etc. Whatever is best to treat this and my dark circles.
Thank you for your question. You're in your early 20s and you submitted a very nice single photo of one eye with very well detailed as to your areas of your concern. And clearly you've done a lot of research and you're using some medical terminology, which is great. The question remains, of course, is what's the best thing to do? You're dealing with what you describe mostly as volume loss. So the issue is whether or not it is best to approach the bulge that might be perceived of the lower eyelid fat that it may be pushing forward, or are we dealing with really volumetric loss from the orbital rim area to that groove, that area of the tear trough, as well as the lateral part of the orbital, in the inferior orbital rim? Well, in the absence of a physical examination, it's very difficult to make a definitive recommendation. I'll tell you a little bit about what we generally do when we see people like yourself in our practice. I refer to people like yourself as people who are kind of on the border, where it's more about the volume loss than it is the fat prolapse. And thanks to more recent fillers, it is actually possible to actually camouflage that transition or restore a little bit of volume along the orbital rim. We refer to this area as the V deformity. Basically, we're looking at just a relative hollow. Now, in my practice, I routinely use hyaluronic acid such as Restylane in this area. But I've also been doing a combination of hyaluronic acid with platelet-rich plasma. There has been some well-established information in the literature of the synergistic effect of the combination of platelet-rich plasma. Platelet-rich plasma is derived from your blood and contains growth factors and helps to improve skin quality. Hyaluronic acid provides some volume, and very often there's actually some more long-term collagen deposition that helps to improve these areas more long-term. A lot of our younger patients appreciate avoiding surgery and having this type of treatment. Some people, if their fat pocket underneath their eye is too prominent, then of course we recommend a surgical procedure. I would caution you, you mentioned in your question about fat grafting. In my experience, fat grafting in the lower eyelid skin, which is very, very thin, it's the thinnest skin in the body, 0.5 millimeter in thickness. There have been many patients who have come to us from all over the world to have me treat them because they had fat grafting and they ended up with a lot of irregularities, scars, lumps, and basically things that certainly were very complex to deal with. I think that if your puffy under eye bag is not that prominent, that you can entertain the use of a hyaluronic acid filler. There is an art to doing this. It may take a doctor more than one treatment to get it just right for you, but I think if that is the least invasive and most effective way to treat you, then that's the way to go. Hyaluronic acid can last from months to even over a year. There's some variability there. If you are doing anything that is in any way toxic to your skin, then it's advisable to stop. This includes smoking, If you are trying to lose weight, or you're doing any kind of crash dieting, or drinking excess alcohol, these are things that are very toxic and can advance the aging process. As a little aside, from a lifestyle perspective. So think about fillers as a starting off point before moving forward with surgery. Again, in the absence of no physical examination, it's hard to appreciate the three-dimensionality of your situation. So I wish you the best of luck. I hope that you're able to meet with some doctors and to explore this option. And thank you for your question.